Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Rotator cuff tear. Sometimes the rotator cuff can tear off. So rotator cuff tear is seen mainly. The question will be given as a young man in his 20s or 30s who actually throws a ball. After throwing of a ball, the patient develops pain and swelling and he is inability to initiate the arc of abduction. He is inability to initiate the arc of abduction. Now if the question is asked, what is the first investigation which is done? So first investigation which is done in this case is ultrasonography, and investigation of choice is MRI. And inability to initiate the arc, this states that it is a supraspinatus injury is seen. Okay, so this is rotator cuff tear.
thank you and thank you for watching.